If there was a procedure out there that reduced your risk of cancer by 50%, wouldn't you do it? I know I would. That's a lot of cancer preventing. Well, what if that procedure was for your colon? Now you're a little hesitant, aren't you? Most people get squeamish at the thought of doing any procedure that involves the colon. But thinking about your colon's health and actively preventing colon cancer is so important because of two simple alarming facts.
Well, colon cancer, of course, is the second leading cause of cancer death in the country. And 90% of people who develop colon cancer are above the age of 50.
You should start thinking about your colon health when your 50th birthday is on the distant horizon. So when you're in your early 40s. Remember, if it happens after you're 50, you should be preventing it well before you're 50. The first thing you should do is talk with your doctor about your risk factors. Those, coupled with general guidelines, will help inform when is the right time for you to begin screening, aka the Colon Cancer Prevention Champion. The American Cancer Society recommends that the average risk patient be screened every 10 years, starting at age 50. The exception is for people who are of African American descent or are considered high risk.
People who have first-degree relatives who have either colon cancer or colon polyps fall into a higher risk category than the general population. So first-degree relatives, of course, being parents, siblings, children. If you have two or more second-degree relatives who have a history of colon cancer, that also puts you in a higher risk category. So now you're talking about grandparents, aunts and uncles, people who have genetic syndromes that predispose them to colon cancer, for example, familial polyposis syndromes or hereditary non-polyposis colon cancer syndromes. These people also need to be screened much earlier and at more frequent intervals than the average population.
The most recommended form of colon cancer screening is a colonoscopy, which is a procedure that involves threading a long, flexible tube called a colonoscope, which is fitted with a light and a camera into the colon in order to look for cancerous polyps. If found, the doctor will biopsy or even remove the polyp, literally nipping colon cancer in the bud.
Because colon cancer is an entirely preventable illness. If polyps are found when they're small and benign, you've prevented people from developing cancer. It is felt that the lifespan from when a polyp develops to becoming a cancer is somewhere on the order of 8 to 10 years. So for that reason, we like to do colonoscopy in a shorter time frame than that so that we can find polyps when they're still small and remove them before they become cancers. Given the fact that it takes a polyp, the average polyp, 8 to 10 years to become cancer, if you are properly screened at an appropriate interval, then you give polyps no opportunity to go on to become cancers, and you can completely prevent the possibility of a polyp developing into a cancer.
Unfortunately, not everyone who should be screened is scheduling their appointments. Only an estimated 60% of adults over age 50 pursue regular screening. The obvious reason why someone may forget to get screened is because colon screening, specifically the heralded colonoscopy, have a reputation of being unpleasant, to say the least. Nowadays, the medical community is working to change that perception because screening is that important.
Our goal now, I think, is to make the screening process as comfortable and easy and quiet and private as you possibly can so that people take advantage of our ability to screen. The room is very quiet and private. It's easily accessible. The recovery area is private, which is very nice for patients because there's a certain amount of embarrassment or personal consciousness that goes on with colonoscopy. So it's nice to be in an area where it's only you until you get dressed and leave. And we have a new prep now that patients like so much better than anything they've ever done in the past. So people are finding the prep, which used to be the worst part of a colonoscopy, to be not nearly as bad as it used to be.
Your doctor will know which preparation is best for you. Some are powders you add to drinks, others are already a liquid, and you'll pick it up from your local pharmacy a few days before your procedure. For those of you who still haven't reached your colonoscopy birthday, don't worry, there are things you can do today to help keep your colon happy and healthy. Diets high in fiber, supplemented with adequate doses of calcium and vitamin D, are shown to reduce the risk of colon cancer. You'll also want to avoid things like heavy alcohol consumption, smoking, obesity, and being sedentary. Get busy moving, and your colon will too. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.